I've been practicing medicine for 25 years, and in my entire career, I have never seen a disease process like this. I have never seen a disease process occupy half of the beds of the hospital, all of the ICU beds. And what this program does is it takes people who are either already in the hospital or in the ER that are at risk for worsening of the disease and puts them in a program where a physician is calling them once or twice a day.
A nurse had reached out to us and helped us get everything set up. So we started monitoring his temperature and his oxygen levels there at home. And it was nice to know that, hey, they can remotely monitor him.
And that equipment is a pulse oximeter, which just measures their oxygen level. A thermometer measures their temperature, and ability to call for help whenever necessary.
Every day I'd get a call in the mornings and then in the afternoons. And I would talk to a physician, and they will check me over the phone just to make sure my vitals were okay. And they asked me for any other services like counseling, because I was having those panic attacks at night and anxiety because of COVID. I really felt like my life was going to end with COVID. Hatch is a rural community. We really don't have any hospitals there. So it would have been probably kind of hard to come back and forth until I got better. So I think this program really did help a lot.
I've never been so scared in my whole life, ever. It was horrible.
The physicians pick up the phone and call them directly and ask them what their numbers are. And we actually have electronic access to those same numbers. And we see how they're doing and see how they're progressing.
And I know that if they hadn't kept calling me, and they hadn't gone and put the system in, and he hadn't kept calling me, making sure that I was doing what I was supposed to be doing, I don't know if I would have survived either. That's why I think the COVID to home program is so important, because you can tell the doctor what's going on.
We are definitely over 200 people we have taken care of. We have discharged over 100 people, and 30 people, 36 I think, have been readmitted to the hospital because we're continuously monitoring them. That's 200 hospital beds. That's 200 people that would have been in the hospital. And I can tell you, we were at the point where we had one bed available. Had this program not existed, many of those people would have not received any care.
I'm glad I was there when his oxygen levels dropped. We were able to hit that help button and actually get ambulance out there and everything very quickly.
Building a structure where we can treat people at home so that the higher resource needs are available to those who need it is really what this program has demonstrated.